Examination of cardiovascular system have many steps. Different authors describe it in different ways, and I am giving you an outlook like at first wash your hands and then incline your patient at 45-degree angle and then introduce yourself to your patient and then seek permission from him and then steps of examinations like general examination of the cardiovascular system. You should know that every system has its general examination in separate. Although we have a general examination overall, that is called general physical examination. That is said in my another video like anemia, cyanosis, jaundice, clouding, cholinergia, indiconecia, and appearance, build, cooperation, decubitus, etc. So now, especially in examination of cardiovascular system, you have to go through your textbooks. I am telling in very short, like you have to examine first in hands, like here is splinter hemorrhage for infective endocarditis and examination of clubbing, and then on your palm examination of genuine lesion, muscular nodes, and then in face I have to examine the xanthelasma in eyes and also anemia and cyanosis in his tongue. Show me your tongue for me, please. And some authors include examination of pulse in general examination. Listen, if you include pulse examination in your general examination, then just go to radial pulse, count it, and see the irregularity, and then see the symmetry of radial pulse. If it is symmetry, there is symmetry or not, and then check for collapsing pulse. That is, ask the patient that if there is any pain in his shoulder or not, and as you have to elevate the hand suddenly. So if he has pain in his shoulder, then it will be an embarrassing situation from the patient. And now you have to examine the collapsing pulse. You have to feel the radial pulse with your head of the palm. Like this, you are feeling the radial pulse, and then ask the patient, এখানে তোমার কোনো ব্যথা আছে? No, he has no pain in his shoulder, and then I am elevating it, that if the pulse is collapsing and hitting it more forcibly in my hands. No, there is no collapsing pulse. And some authors include examination of jugular venous pressure in their general examination. You can do general physical examination before examination of precordium or after examination of precordium. For examination of jugular venous pulse, you can see the jugular venous pulse pulsating here. That is anterior border of the sternomastoid muscle, and it is going upwards. You have to know the examination of jugular venous pulse is indicating the pulse, indicating the mean pressure in right atrial pressure. That is right heart pressure. That is central venous pressure. As the jugular venous, internal jugular vein is directly communicated with the right atrium, so it is indicating the right central venous pressure in this patient. So I have to locate the top of the jugular venous pressure, and then from here I have to measure the length, longitudinal length from this upper limit to sternal angle, and then I have to add 5 centimeter water pressure for this pressure. I am explaining it more that the heart, center of the heart is lying 5 centimeter below the sternal angle. This is the centimeter water pressure of jugular vein, and if it is more than 9 centimeter, so I have to consider that there is elevated right atrial pressure, and the causes should be interpreted later on. Okay, then I have to go to examination of one thing about pulse. The general physical examination pulse examination is ended here, and if I want to examine the pulses in details, then I have to examine the other pulses. That will be done in later in my video. Now I will discuss last of all in today's session, that is examination of blood pressure. How you will measure the examination of blood pressure. You see, I am taking a normal sphygmomanometer in my hand, and the artery is marked here. The two tubes will be placed across the approximated side of antecubital fossa, more than 2.5 centimeter above the line, and then I am tying it well, and the manometer is at the level of the heart. Whichever the hand, that doesn't matter. It is on right side or left side, that doesn't matter. Okay, then now I am tying it, and I am doing it on palpatory method. In palpatory method, we have to feel the pulse in brachial artery or in radial artery. I am palpating the radial artery because it is easier, and I am elevating the sphygmomanometer by 2 to 3 centimeter per second slowly, and where the pulse is disappearing, I am remembering that, and elevating more than the pulse, the reading 20 to 30 centimeter above the reading, which was where it disappeared, and then I am putting it in the brachial artery area, and then slowly releasing the manometer. Now notice that where the sound again reappears, the reading of disappearance and reading of reappearance, the average of the two readings are the systolic blood pressure, and where the sound is disappearing, that is the diastolic blood pressure. And it should be described like this: the blood pressure is X millimeter mercury over Y millimeter mercury in left arm or right arm in supine position, and there is no postural drop. What is postural drop? If the blood pressure is getting down more than 10 millimeter mercury in standing position, then it is said that there is postural drop. Then I will ask the patient to stand up. I will ask the patient to stand up and then wait for 1 minute. Wait for at least 1 minute, and then examine the blood pressure again. And now the systolic blood pressure is, if it is more than 20 millimeter mercury drop, and the diastolic pressure is more than 10 millimeter mercury drop, then there will be said that it is postural drop in blood pressure. And this is enough for today's session, and then in next session we will discuss about examination of the precordium proper.